Thank you so much for the introduction, dear colleagues. What I am about to present here are the very first data coming out from the Approach IS2 study. And I'm honored and humbled at the same time to be the spokesman for an army of people who made this, this project possible, and many of them are in this room. But let me give some background. It started in 2013 with the Approach IS study, the first Approach IS study. That was a study in which we included 4,028 patients from 24 centers, 15 countries, 5 continents. It provided such a rich data set that allowed us to make heat maps like this. And some of you who follow the literature since long may have seen this kind of heat maps, in which we could tabulate the scores on the different patient-reported outcomes in the different countries. Approach IS, let me call it Approach IS1, also allowed us to see what are predictors for patient-reported outcomes. And there was one article where we tried to summarize it into the medical, demographic, behavioral, psychological, and social predictors. And this is indeed how the world map looked when we were talking about Approach IS1, all the centers in the participating countries. And although I'm very proud of that project, I also was disappointed and a bit frustrated by this fact. We did not have centers in Africa. So we could not truly cover the global burden on congenital heart disease. Another aspect that we have to bear in mind was that all of these centers were high-income countries, except for two, and that was India and at that time, Argentina. So that clearly means that there is still much work to be done, and there are still other things that we can learn. And that triggered us to raise the following research aim, which is to further explore differences in a modified selection of patient-reported outcome measures and patient-reported outcome experience measures by enrolling adults with congenital heart disease in low, middle, and high-income countries. And indeed, where the map for Approach IS1 looked like this, for Approach IS2, the sequel, it looked like this. So yes, we were able to recruit patients in 53 centers from 32 countries in 6 continents. Admittedly, Antarctica is still not covered. We can work on that later on. So overall, 8,415 patients. Obviously, still a high selection of high-income countries that are represented, but still, we have 7 upper middle-income countries, 4 lower middle-income countries, and 1 low-income country. One could say it would have been better to have more low-income countries. Yes, that's true. But let's be honest, the low-income countries, they have so many challenges. Participating in an Approach IS study is probably and understandably the least of their concerns. So even one center we appreciate. What were the variables and the measures that we used? We measured health status using the RAND12 health survey and the Eurocall 5D visual analog scale. Depressive symptomatology was assessed using the patient health questionnaire 8, PHQ. Anxiety was measured using the GAD. And quality of life was measured using a linear analog scale as well. And again, making a heat map, it looks like this. So this is the heat map on these 8,415 patients. Let's zoom in. The country that had in general the best patient-reported outcomes was Switzerland. The country that participated, that in general had the worst patient-reported outcomes was Senegal. But it doesn't mean because you are on top of the overall patient-reported outcomes that you are good in everything. For instance, when you look at the mental component summary, the second column, there you could see that Malta is doing better than Switzerland. When you look at depressive symptoms and anxiety, surprisingly enough, Pakistan was doing better than the other countries. But this is, in this table, you can see the mean scores. If you really dichotomize it, to see, do people have an elevated level of depressive symptomatology? There we found that Netherlands was doing best. So the lowest score on both depression and anxiety was found in the Netherlands with 9.8 and 8% respectively. At the other side of the spectrum, Turkey was doing worst with 48.8 and for depression, or depressive symptoms I should say, and 29.4% that was found in Chile for anxiety. The good thing of a heat map like this is that it provides you detailed information on the different patient-reported outcomes. And it's not because you are relatively high in this kind of ranking, if that would be the correct word, that you are doing good on everything. And for instance, Brazil is a nice example on this. It is third in the overall patient-reported outcomes, but it is not doing good in terms of anxiety. So that clearly means that our colleagues in Brazil now know what they have to look at. Because this could be a trigger, or this could be a target for interventions where they can make the most difference. And the opposite is also true. For instance, Colombia, who is rather at the bottom of the spectrum, but still, again, for anxiety, they are doing pretty well. So therefore, our colleagues in Colombia should probably focus less on anxiety among their patients than our colleagues in other countries. So this means that once that we have published these data, everyone should really look at their country and see what are the focuses, what are the things I should look at mainly. Let me come to the conclusion of this presentation. Yes, there are large inter-country disparities in patient-reported outcomes. And we need to make sure, of course, that we, in the sub-studies and in the additional analysis that we will do, that we try to better understanding what explains this difference. Why are people in this country reporting this kind of outcomes? Why are people in other countries doing differently? This is still to be explored. And yes, Approach IS2 is a pioneering international endeavor that comprehensively evaluated patient-reported outcomes in adults with congenital heart disease. And even with a high representation of high-income countries, at least we had one low-income country and some lower middle-income countries. Like I said, I'm the spokesman for an army of people, and I want to acknowledge all the authors who have contributed to this particular abstract. Thank you very much.